are live. Guru Nation, AQST Nation, and for those of the uninitiated, AUR Nation, which I am a tiny member of. Tiny. I get my beak wet a little bit, a little bit, just a little wet the beak. But AQST, I'm in much more than a beak, and I keep wanting to get more. The problem is running out of cash to do it. But I got Biotech Scanner. Today's a good day to celebrate with AQST for many reasons. But Biotech Scanner, you guys know him. He's a legend. He's going to retweet this right now. And
That's what yep.
We're about to go viral again. But we're going to discuss, well, he's really going to discuss AUR because, first of all, I know very little about AUR other than what he's told me. And I've bought just a little bit. Now, I did like no financial due diligence on AUR. Like none. I just I know Biotech Scanner now long enough to know that okay, I'll take him serious. But I'm still like team AQST. I can be converted also to team AUR and or diluted, if you will. 'Cause, you know, I mean, limit like microeconomics. I'm in this microeconomics course right now, and you have constrained optimization, right? Like money is you have your limits, you have your boundary. Like I can't just invest in everything. Of course, every red day I would buy more AQST. Like I've done so much due diligence except for today. I haven't read anything about this conference.
Okay.
So I'm really glad you're on for multiple reasons. I'm here to learn from you. And yeah, take it away, Biotech.
Well, I thank you for having me again on here again, Dan, and thank you for those of you who are joining. AQST Nation or AUR Nation. Let me start off with AUR first, and then I'm going to spend the rest of the time with AQST because there's much more to go over with AQST. The market decided to take a break. Let's put it this way. However, I've mentioned so many times that when you find a good company, you add on red days, right? And I've done months of DD on Aurora innovations. They are into autonomous vehicles, trucking and normal cars. They have gigantic partners who they don't just name drop, and these companies talk about them. Toyota, Volvo, NVIDIA. You're talking about park car. I mean,
Uber?
these
Was it Uber?
and Uber, yes, and Uber invested like $900 million into Aurora, and so this company, believe it or not, where it is at, I see the potential is just enormous. Now you have to kind of go and invest long term with this one. So this one, I believe, is kind of like an early Tesla days kind of thing, opportunity. And I'm investing. I've done all my research, and I've invested quite a bit in it. And it's with the money that I'm willing to risk. And so you need to do your own research and all that. But the biggest catalyst that they have is that they are actually launching live commercial with 20 semi trucks going down I-45 from Dallas to Houston without a person. Now, they have done it. They already FedEx is one of their partners, so they have been hauling FedEx stuff using Volvo trucks, going down to Houston, and they've done it for almost 2 million miles already. And weekly they're doing like 25,000 miles back and forth. So now the only difference is they still have called a safety driver in there supervising the truck to see what's going on. They need to intervene if they need to, and they hardly ever do anything. As a matter of fact, one of the partners is Warner, which is one of the big trucking company. One of their executives thinking about investing in and partnering with Aurora. He took a ride with the truck, and after it was over, it's like, oh, we're in. So you're talking about less than 3 months. It's going to go live. And once it go live, and if it is successful, it's not going to be $4 where it is right now, or close to $4. It's not going to be even close to that. It's going to be way up there. I think it may go to about 15 or so by the end of the year. So remember now, they are doing semi truck, but in the future they're going to use that. So they have a thing called the Aurora driver. That's the brain of the autonomous driving hardware and software, and they are partners with Toyota. So in the future, it may be in all the Toyota cars and things like that. So any manufacturer wanted to have that capability, they could, partner with Aurora. Aurora is getting paid by the mile with trucking, and it's the total addressable market for trucking in the United States is 1 trillion. Globally, is 4 trillion. So that's just on the trucking side. I'm not even talking about the ride hailing side where they have partners with Uber, right?
Yeah.
So the risk
That's
is
one,
high.
if I can click it, double click this part,
Okay.
the Uber angle to me is the most memorable one when you told me, because I'm a student of startup world and tech, and even though I work in biotech like you, I'm fascinated with tech startup. And Uber, I remember I used to invest in Uber a long time ago. Their thing was like their long goal was trucking and driverless trucking, like logistics. I don't know if this investment means that this is their way of getting into this, or do you know if Uber is still doing their own things independent of this, as far as maybe not competing but in the same space, or is this their play on that?
Very good question. Very good question. So Uber was in it, right? And one of the executives came from Uber. And so they actually sold that division to Aurora. Okay. So that's where the investment comes in. That's where the $900 million comes in. So this is why
Okay.
this is why
Now I'm
this
more
is why I'm saying that I believe that they put, I mean, seriously, you know how much I love AQST and the
yeah.
potential that present for us, right?
Yeah, you're like synonymous with AQST right now.
So AUR Aurora's potential, I believe, is 10 times that of AQST.
That's a
Okay.
crazy statement from you.
So, I mean, think about this. Volvo, Toyota, NVIDIA, PACCAR. I mean,
Let me
Uber.
ask you this though, real quick.
Okay.
Which one is a riskier investment?
Right now, believe it or not, it's going to be Aurora because AQST is so close to get NFL
Yeah.
approved. And I'm gonna go over that. It's awesome.
Yeah. All right.
But Aurora is a higher risk, but the reward is astronomical, right?
Sure. Sure.
So that's I'm gonna leave it at that. Do your own research, but I'm telling you that I've done all my research, and besides AQC for this year is AUR with just a tremendous opportunity. To me, it could be an opportunity of a lifetime. It's one of those like, oh yeah, oh, we have autonomous truck now. Oh, I invested in that, right? So
Now, are these
don't
autonomous trucks like AUR brands, or are they gonna be like you said, Volvo, Toyota? They're all using, like, will it be a household name? Meaning, like, will you be on the street and you see Aurora trucks going by, or do you see Volvo, Toyota, and you don't know the difference, but it's all Aurora in the background?
That's a really good question as well. I believe that you're gonna see the trucking brand. You're not gonna see the Aurora name because it's just the brain of the truck. And the great thing about this, somebody asked this on Twitter, is that they said, well, the future is electric. Why are we talking about diesel? The beauty of AUR is the brain works with a diesel truck, gasoline truck, hydrogen truck, electric. It doesn't matter, right? So, but Continental, um, and Park Car and Volvo, I mean, they are the making the truck, and it fits in the truck. So so you know, anybody could buy this for their own trucking company. So you're not going to see the Aurora brand on the outside. Okay, now you do, but in the future you're not going to see that. It's going to be in the inside of the truck. You know, and so I'm very excited about it, and I think it's a tremendous opportunity.
In a
So
way, it's just like Boeing. Not to use Boeing because it's horrible lately, but Boeing or Airbus. You know how the logo is Southwest Airlines, JetBlue, Delta,
right,
right?
yep,
But it
right,
was something similar to that.
correct, correct. So it's the brain. And what's amazing to me is I sent out the Investor Day conference that they had. It is amazing to me. It's 2 hours and 15 minutes long, but each of the partners got on stage and they described their relationship with Aurora. These are huge companies like Volvo, Park Car, Continental. These
Wow.
huge companies talking about, you know why? Because these companies have dreams of autonomous truck or logistics, like Uber Freight. Their Aurora is the main character in this story.
Aurora is basically like if Uber Logistics
Yeah,
spun off into its own startup,
yeah,
right?
right. So I'm telling you that they you you are the main character in this autonomous story,
Mm-hmm.
and it's below $4. Okay, so this is why I'm saying I believe it's a once in a lifetime opportunity. It's high risk. You got to make your own call. Don't follow me. I'm just sharing you my research that I've done.
Mm-hmm.
But it's very exciting time. So now let's transition to another exciting story.
My
Which
favorite.
is therapeutic. So I last week I tweeted out the conference today, the XC Wainwright investor conference, and it happened at 8:30 a.m. Central Time this morning. Oh no, 8:30 Eastern Time, 7:30 Central Time, my time. And so for the first time at a conference, we actually have the senior VP of sales and marketing for Aquestive Therapeutic, and that is Sherry Krasinski, and he pronounced it Krasinski. Um, and I didn't expect that, but when I opened up the link and I saw her, I'm like, so I tweeted out, I said Sherry Krasinski, because I knew we're going to have a good conference today. For those who don't know, Sherry Krasinski is the biggest name in the epinephrine rescue space. She's the architect in making epinephrine, the EpiPen, into a blockbuster. A blockbuster meaning over $1 billion sales every year. Okay. So, and she did all the groundwork. She did the efficacy, she did the school, she did the hospital, she got, everywhere. So now all those places they have EpiPen stored. Well, guess what she's gonna do for enophylline? She's gonna be doing the same thing. And today, when she spoke, she called out, and I did not know, I did not expect it. She called out Neffy by name because to her, Neffy is not much of a difference, compared to EpiPen. It's not going to change the carry curve as much as what everybody's been waiting, which is the oral formulation that Aquestive has, which is the film. Okay. Another thing that she went into was the durability that we don't talk about much, Dan, of the film. Small, like a postage stamp, only has contained 2% water content versus 98% water with all the other devices. So when you have that much water content, you're going to be much more affected by high temperatures or low temperature, like the freezing or hot temperature. Okay, and she went, over the fact that even Netflix still has a carrying case. That means every day they have to make an active decision to carry that thing everywhere they go. Whereas, and then she actually used her own phone on a sleeve, the pocket, to put and a film in it that the patient could carry anywhere.
Wait, is this just really quick? I'm like asking a dumb question. They're supposed to be doing something on September 27th. Did they do it early, or was this an unannounced event? What
No.
they did today?
Yeah. So there was some confusion. I was kind of confused too, because on the earnings call, the CEO Dan Barber said, in a few months we're going to have an investor day to where we're going to reveal the indication of AQST 108 and possibly new drugs that's coming out of the
Right.
Adrenoverse
Right.
platform, right? So, and then right after that, they sent out a PR with the two investor dates. One with HC Wainwright, the other one is Lake Street, which is 3 days from now. So it's going to be on Thursday, and it's going to be the same thing as today.
Okay.
So I thought that maybe today was the day that they could actually do that, but I'm so glad that they did what they did today. Early this morning, before market opens, they sent out a PR about the investor day. So that clarified everything, and they explained what's going to be happening on Investor Day on September 27th.
Gotcha.
So they did not reveal anything today, nor Thursday, which is awesome because
The way the stock moved today is like that was the event, right? But this was just a bonus event.
yeah, and I tweeted out today that I said, I always tweeted out, hey, don't worry about the price movement on red days. I always do it on red days,
Yeah.
just stay calm.
Yeah.
It was up about 9 or 10% when I tweeted out, hey, I tweeted that telling you to ignore the price action on red day. I'm telling you to do the same thing on green days for AQST because it is only 460 something. Where we heading? We're heading to 15, 17, 18,
The
20.
moon.
Yeah. So, so I said, just don't worry about the price.
Market cap only 380 million. Like that's nothing. I won't be excited till it's $1 billion.
Well, yeah. So Sherry Krasinski went over the launch plans for NFL, right? So you went over in detail of what's going to happen, and
The replay is available for people.
yes, there is. So if you want a replay of this, I tweeted it out.
Okay.
But you can go on the website, click on investors, and there's events. It's there. It's only 20 minutes. Okay. So and you get to hear Dan Barber and Sherry Krasinski. So she went over the launch plans and everything. Gosh, so what they're gonna do is they're because they're launching Libovan right now.
Yep.
And they're going to leverage that launch experience, and they're going to roll it over right into NFL launch, which is exactly what I said is going to happen. So I tweeted out, I said, whatever Sherry said today, you heard it from me prior to that. You know what? This is where I brought 19 years of experience. I know the play-by-play.
You're very actively involved in that exact role of drug launches and rollouts.
So I will continue to do that as we move closer to the launch of NFL. And even with the pediatric trial and all that, I'll go behind the scene of what's going on there. But yeah, we, as the CEO said, we are on a path of just a de-risk path for NFL approval. Because the NEFI approval is really very, very positive for NFL because it's saying that the FDA is willing to accept a non-needle treatment, epinephrine treatment.
Right.
And so what I now one thing that Dan Barber pointed out, and I have not seen him this excited, when he said, for the next 10 years, the Adrenoverse platform is what's going to carry this company. So it's telling me that on Investor Day on September 27, he's going to drop some bombs. Okay.
You think so? You think he's ready to drop some bombs?
Oh yeah. So let's say he's not dropping anything. He's not adding to anything else to the pipeline. Okay, let's say there's nothing. The current pipeline that AQST has, it already has a 1.5 billion potential sales every year. Compare that to the market cap of 85 million right
And
now.
that's not including 108, the derm, where we get an indication for that, right?
So the 1.5 billion is already including the derm.
Okay.
What I'm saying is that the 1.5 could be much higher depending on what they're revealing.
Because we don't know the derm indication, right? Like if it's just allergic reaction skin, right, versus atopic derm, that's a much different market that we're talking about.
Yes. And the thing is, another thing that I want to cover that's kind of go unnoticed, and I tweeted this out. Very important. Every drug that a company spends time developing, all the way from development to commercialization, you have about 17 years, but that patent life started counting at the moment that your patent is given. So what I did not understand was Neffy wasn't ready to launch at approval. This is after a 10-month delay.
Right. So they're wasting time. Their ARS is wasting time because
precious time.
Yeah.
Okay, and I shared this earlier. Okay, Dawn and Export sold their priority review for 105, 103, 108 million dollars. A company is willing to spend over $100 million just to get an extra 4 months of approval, earlier approval.
Wow.
So that tells you how valuable time is. And to see that Neffy is approved and they're not ready for launch. The drug is not ready.
That they're rookie, like.
Well, so now comparing that to AQST, they are in pre-launch mode more than a year prior to approval.
If ARS had just the team for Libervant, just the pediatric Libervant team, they would have already been generating sales. That shows you what kind of infrastructure AQST already has.
Yes.
Serious stuff people don't understand.
Yeah. And so to me, it's just unforgivable. Now, I think I know why.
How has that stock been doing? Have you been watching? I haven't watched it.
It hasn't done as well as AQST. I can tell you that right now.
Yeah, SPRY stock. In the last month, it's only been up 7%. AQST in the last month, 36%. So there you go.
So back to the reason why they're not ready for launch. This is why huge advantage of AQST that nobody's talking about. AQST is its own manufacturer. It produces its own device. It's actually not a device. It's a drug.
IP. Yep.
ARS has to rely on third party to use that Narcan device. Do you see?
That is on. No one's discussing this, man.
Nope.
You're right, because AQST has 50 million a year revenue, and other companies using its own infrastructure to make their sublingual or whatever. Usually, it's sublingual.
Yeah, AQST is a manufacturer.
So they're not even relying on any other company.
Nope.
Maybe someone to get that generic epinephrine. I don't know that in depth, or do they have that in house? Or
no, so basically foam film technology. That's how they're making money, right?
Right.
And so they were just gonna use that manufacturing capability for Enofilm.
But they have to buy the raw. They have to buy the raw epinephrine somewhere, no? Or they make.
Yeah. And and I'm sure they that's probably very easy, right? It's
Right.
everywhere, right? That raw material. And
Yeah.
so that is why.
You're talking about the actual delivery mechanism, which is the
The
Listerine,
film.
right?
Yeah.
That's their proprietary.
Mm-hmm.
Man,
Yeah.
you just got me even more excited because
So
I never considered that as well. I'm so busy trying to be bearish. Like, where am I missing? I've been burned so many times. I'm like, where am I missing? What am I? And then I totally missed that part.
yeah, here's another. The CEO actually brought it up. The phone film technology and the Adrenoverse platform. He said we have the ability to control the rate of absorption and to control the rate of delivery of the drug. That's that right there. That combination right there. They can control how fast they want epinephrine to be delivered. So based on different diseases, so you don't want it. You don't want epinephrine to
Say
be
that part again, though. I think people in the back didn't hear us. There's
okay.
one more.
So the CEO said that we have with our technology, the Adrenoverse technology, we have the ability to affect or to control the absorption rate of epinephrine as well as how it's delivered. So, because you don't want to deliver epinephrine at the same rate for different diseases. There's some that you don't want it to be that fast, like anaphylaxis. You don't want it to be, for some disease, you want it to be a little bit slower for it to take effect. So I think that's the whole scheme of the Adrenoverse platform is the control of absorption and the release. So,
Man, you got me even more bullish.
so
That
but
part, yeah, and he said that today, right?
he said that today, and I guarantee you 99.99 people listen to that, they had no clue what he was
Right
talking about.
over their head. And no one's really thinking about those things because we're so trained in thinking about a product. Like, oh, what's the next catalyst? Okay, at PDUFA.
Yeah,
And then look, like SPRY, big deal.
yeah.
PDUFA and nothing's happening.
It's this is why I said that investors sleep better than traders. Okay, you find a good company, you do your own research, you find your own level of conviction in it and how much you want to invest in it, and you stick with it,
Man,
right?
I'm sleeping good. I'm having lucid dreams and everything at night. Now I'm sleeping even better.
so, so hopefully, people listening go back and watch that conference. And if
Yeah.
you have any questions, you can tweet at me asking me questions. So what could go wrong with Aquesta? People always want to know. With just like with any pharmaceutical company, there may be delays. They may get a CRL. I'm telling you, it's a matter of when, not if, and the film will get approved. So even if they get CLL, it may drop 20 or 30%. I'm gonna buy more. um, but
Me too. Especially with this last part, because what the CEO just said and what you highlighted, which is very good. I think we need to double click on this. Controlling the amount, the rate, and the delivery. So they're already the next thing they're proving that with is with the cream. We think it's a cream, right? Uh,
correct.
for derm. And even though that's not a sublingual film, it's part of the Adrenoverse where they're able to figure out ways to control the rate. So this company is just getting better. Like the fact that they started as an infrastructure first and then worked their way into developing these products. And I
Yeah,
think Ibervant is a good example. They reverse engineered the rectal gel and
yeah,
they turned it into subbuccal, right? The cheek, they put it on the side of
yeah.
the
The buccal film, yeah.
buccal film.
So the market cap right now is under 400, and they have potential sales of 1.5 billion, not counting the major multiple drug candidate that may come from the Adrenoverse platform. To me, it says This is a can't miss opportunity. Again, you still have to do your own DD. Don't follow my investment or Dan's. And it's when Dan Barber brought on Sherry Krasinski. That is when
I'm trying to get her on biotech. When I do, we're gonna co-interview her. I'm
okay,
just trying. I'm gonna keep messaging her on LinkedIn because the number I have is not her cell.
yeah.
But she replied on LinkedIn that yes, let's do it. So now
Yeah.
it's just a matter of scheduling it.
Yeah, I'm sure she's very busy these days.
Oh,
And
yeah.
they keep hiring. They keep adding these. So they had a DTC, person. That is a person that's in charge for marketing, either print, TV, or online. I mean, so basically, what I'm seeing, is that's the launching infrastructure. You have to have these pieces in place to launch a product successfully, and I guarantee you, I know they're launching Libervent, but they're thinking NFL. That's exactly what they're doing. And
Yeah.
so,
And the reason you want that Libervant, like the reason that was such a good way to go about it, they took like a much needed indication where they knew the FDA would say yes. That was like almost a guarantee as long as the data was there. They can develop a small team. It's almost like a gift. 2 to 5 year olds, right? That's the age, right? 2 to 5.
correct.
They don't need to worry right now about adult. It's very hyper focused, narrow. Just develop and train a very good Navy SEALs type of a sales team.
Right.
That's, you know who wishes they had even that small team right now? SPRY, Neffy. If they had that, I don't know what they're doing. I'm not an investor.
Well, I think they have the sales team now. The funny thing is, I still see them hiring reps. I'm like,
so maybe their problem is the supply chain of getting the stuff made.
yeah. So I believe it is not. I think they still have the sales team ready. They just don't have the drug made, and then that's part of the advantage of like AQST is it is its own manufacturer, right?
No
And
relying on
not
China.
any,
Remember during COVID, like all the drug companies were having issues supply chain with China.
yeah.
You know, maybe that's not the case. I just wonder where the raw epinephrine comes, but I guess that can come from anywhere. Doesn't
Yeah.
have to be China.
Yeah. So I'm
But
very
those devices probably come overseas, man. I don't think they're doing those things here.
probably yeah. So
Hmm.
it's a Narcan device.
But you
Yeah.
see how easy it is to miss the detail. The devil's in the details. So if you look at it, I mean, every biotech investor does this. When's the PDUFA? What's the chance of it getting approval? That's all you look about, and you don't look under the hood.
Mm-hmm.
Where's the supply chain come from? What's the
Well, why do you think most biotech investors lose money?
Yeah, I mean, I lost money on KMPH after Astaris got approved for ADHD. After we
Well,
were no one was looking after.
I've said it many times that if you want to invest in biotech, you better find a community. If you do it on your own, I promise you, you're going to lose money unless you have a tremendous amount of experience in biotech. Okay. You can do that on your own. But if not, you better find someone reliable. Okay.
But what do you think about like things like StockTwits or like Twitter or Reddit? Like those are communities most people go to. But what do you think about your experiences with those kind of communities?
I used to be on StockTwit until I see, oh man, it's a dumpster fire. So I deleted my account, don't have that anymore.
Why? What do you think is wrong with it? Like, what is not good about it, do you think?
I think there's so much manipulations on there. People go on there if they want to short the stock, they just bashing the hell out of it, and then if they're bullish about the stock, they just whatever.
But they do on Twitter too, no? On X, they do that.
Yeah.
And
So
it's the same.
Yeah, I think I like Twitter. Just I don't know why. It's the instantaneous nature of it, I guess. The interactions. I know
Less anonymous, maybe. Is
Yeah, yeah. I mean, yeah. But for some reason, I feel more of a close up interaction on Twitter, on X, than I
yeah,
am
yeah.
with other platforms. Even like Discord, it's okay. I have my account, but I'm not actually using it at all.
Mm,
But X is where I feel like where it's at.
yeah.
It's a great platform.
And I think putting a face to a name, like I think that's why you've done so well, is because you put a face to your name, biotech scanner. The reason that you don't share your real name is you actually work in this industry, so you don't want things to get back to
Right.
you don't want complications with your day job. But as far as like not hiding behind an anonymous
Yeah.
account like they do on Discord and Reddit. Reddit is all about anonymous and
Right.
stock twits also. I think you have a point with X. Like I think there's something here in the long run to build like a community of like-minded people that are not afraid to shoot down their own ideas. Like, look, man, as much as I love AQST, 70% of my time I try to find what's wrong with it. And
That's
that's
not
the way
wrong.
I've been burned too much, man, to like drink the Kool-Aid anymore.
You know what? People always ask, how do you do it? Well, I always started with what you just said.
Hmm.
I tear the hell out of it. What is wrong with this dumpster fire? What is wrong with this stuff? Why is it $2, $3? Why is it not 20 if it's that good, right?
Mhm.
So, but yeah, so I've done all the tearing up
Well, the
and
worst thing so far with AQST has been the dilution events when they've done it, which is, I mean, we understand why they did it, but that's the worst part so far. That
yeah, but they have to, right? I mean, how do
right.
you
Well, some
again?
companies have to. Some That's why it's hard to find the winners from the losers, man. Some companies do it because they have to, like
Right.
AQST, and
Yeah.
others do it because the employees have, like the executives have to. Like,
Right.
hey, we need to pay ourselves. Let's
Right.
keep this dumpster fire going a little longer.
Yeah. So it's and but I'm very thankful. We have a very strong Questive community.
For
Um,
such a small market cap, yeah.
yeah, and the thing is, just like Warren Buffett says, find a company that is cheap, understanding what it does, what do they do, their products,
Yeah.
right? And invest in it when nobody wants it, right?
And having that moat that you
Yeah,
said, that defensive, what makes this different, I think what you just said is the ability to have like your own manufacturing,
yeah.
the ability to make money. I don't see SPRI making money right now making drugs for other people. AQSD does.
Let me give you one major nugget, another thing that's related to that. There are so many times a company would do everything right, from drug development until PDUFA, right? So, right, and the drug, the clinical trials, everything works really well. And it's ready to be approved, and then bam, CRL, complete response letter from the FDA, is rejected. Why? Not because of the drug, it's because the third party that manufactured the drug did not pass the FDA test with their facility.
Yeah.
With a Questive, they control their own destiny. They produce their own drug. They manufacture their own drug. They control all of that. And the CEO already said the FDA has already looked at all of that, and they're all fine with that. And the thing is, they are constantly making drugs for other companies.
Right.
So it's an ongoing operation. That's part of their revenue every year, right? So again, just one more thing that makes AQST such a special investment, a special company. And I sleep well at night investing in it.
Now you are just the kind of, unless you wanted to cover other things, I had like a question about the sales process.
Hit me.
Okay, so the last biotech that I was very bullish on, not as bullish as this one. Wasn't as well versed on it as this. But I've had the CEO on many times, Travis Mickle from KMPH. So I actually, and I didn't even lose that much, but I could have lost a lot more. It was the stock called KMPH Chem Farm, and they were actually licensed from Aquestive. That's how I found out about Aquestive.
Aquestive, right?
Right, because I was like, okay, well, they owe Aquestive this, and then Aquestive owed them royalties due for something. They had deals in the past. There was a rumor actually at one point that Aquestive would buy Chem Farm. And that's when I, as a Chem Farm investor, started looking at AQST like, shit, well, I'm all in on this, but like, maybe I need to start looking at this. And I started buying AQST like I'm buying AUR now. Just a little bit more. Pretty soon you have a lot, right?
Yeah, right.
PDUFA went well. Boom. The stock ran up just like I knew. Like, you're going to get approval. It did. Boom. Everything was perfect. And then the stock stopped running. It started tanking. Then they had issues selling the drug. They had issues selling Astaris because it was very expensive. The biggest complaint from people were, man, this thing, yeah, it's good, but like it's just Ritalin. It's just a repurposed Ritalin. Why is it so expensive? Oh, well, there's no like off time. You know how like with regular Ritalin you have spikes. With this it was like just like Harper said, you can control the rate. Like it was smooth throughout the whole day.
Right.
But people were not willing to pay that much more, like 10x more to have that, and doctors were not willing to prescribe it. And since then they got taken over. It was like a hostile takeover. Which it's still a good science. Like so the issue was sales, very similar to SPRY, maybe different reasons, but the end result, if you're not selling, you're not selling. Who cares what's the reason? You're not selling. Right. I think people don't understand this. People celebrate the PDUFA. Yay, we get approval. Why are we not selling? It could be a number of reasons. The market doesn't want it. It's too expensive. Competition. Like in Neffy's case, issues getting the supply. First of all, just maybe walk us a little bit through how to do due diligence on that, because how does somebody even start to do due diligence on this stuff?
That's a really good question. And the question was addressed in the conference today. Okay. And it's relating to costs. All right. So you brought up the cost. And Sherry Krasinski said, we want to make sure that all patients have access to Anaphylm. So she already said the price of Anaphylm is going to be the same as the current treatment on the market right now, epinephrine or Neffy or Auvi-Q. So that is out of the way. How do we know if the drug is going to be in demand or not? Right? This is why I said you don't invest on your own, because I am telling you, I have 19 years of experience in pharmaceutical industry. I know what will take off, what is not, and I can tell you right now that the uptake of Neffy will be pretty strong, but in the back of their heads, in the back of their minds, they already thinking, but there's a film on the way.
But who's thinking that? The doctors? You think the doctors are waiting?
The doctors, and this is why what Sherry Krasinski is doing is so important. She's going around telling everybody about Anaphylm a year and a half before it's approved. And so when the Neffy reps in the doctor's office talking to these allergists, one of the number one objection that's the rep lingo that they're going to get is, oh, that's really nice, but don't they have a film on the way? They're going to get that over and over and
how
over.
How can they legally do that, though? Like, what are the ways that they do that legally? Because there's drugs not approved yet. So how do they educate doctors before it's actually approved? Like, what's the art of doing this?
Oh, yeah. No, you are allowed, and this happens a lot. Actually, you are actually even allowed to give release partial clinical trial results to physicians even. Okay. So you are, so it's going to be a non-branded thing that there's a sublingual epinephrine, in the process of getting approved. And so, and they go to these CME, these continuing education places, and they're on displays everywhere in the, whatever. So and these doctors, they have to go to these conferences, and they're going to see a booth set up with, so they're going to be, everybody is going to know NFL way before it's approved. Okay. And so how do we know? Okay. It goes back to you checking these boxes. Is it addressing a major unmet need? And the major unmet need in the rescue epinephrine space is carrying the drug that saves your life. It's a life or death situation.
So comparing and contrast with like the ADHD one for kids, right? It's not the same unmet need. There's plenty of generic competition.
Yeah. And on the conference call, on the HC Wainwright conference today, Dan Barber gave a statistic. There are 33 million Americans that should be carrying rescue with them. 33. But right now, there's only 5 million rescue epinephrine written every year. Now, okay, that's less than 6% of the population doing what they're supposed to do. But think about this. This is how big potential for AQST is. With that 5 million scripts, that is $1 billion market.
Yeah.
However, they have done the research. Doctors are telling them that when Enofilm is approved, they're going to be writing a lot more because more people is going to go into offices and say, you know what, there's no needles anymore. I can carry this with me in my wallet on my phone. Oh yeah, that's insurance paid for it. Might as well. So think about this. Even with less than 6%, the market already is at 1 billion. So when you improve the carry curve, you are actually also growing the market at the same time. Think about it. Even if you're just taking the market to just 10% compliance, that's already more than 2 billion market.
So if you're so like my niece, for example, has a very bad peanut allergy. I know because when she's at our house, we got to make sure there's no peanuts around, no one's eating it. She goes to Benadryl, right? But she's supposed to carry a EpiPen. I mean, she rarely does, but she says she has one in the car. And then she lives in Las Vegas and in Arizona, where it's like the two hottest places you could possibly be. I don't know how effective that's going to be. I doubt she's checking the expiration date and getting it renewed. But how does that work? Let's say she goes to her PCP. Mm-hmm. They go through, hey, you're on peanut allergy. You still have peanut allergy? Yes. It's last time you had one, it was really bad. I couldn't breathe. I took a bunch of Benadryl and it finally went away. Is the doctor at that point supposed to say, hey, I'm going to write you a script for this Enofilm? I want you to carry it with you at all times. Is that like how that goes down?
Yes.
Or does the patient have to ask, or like what? How?
No, that's actually the doctor's job. But sometimes we have an educated patient that's seen on TV, an ad in a magazine, or or a flyer somewhere that say, "Hey, doc, I heard about this Enofilm thing for severe allergy. I have epinephrine EpiPen now. Can you give me that?" Most of the time, it's going to be the doctor say, "Hey, there's a new option for you. I'm going to write you a prescription for Enofilm. You now can carry everywhere you go. It fits in your phone or in your wallet." So that's how it goes down a lot of times. So it could be either way, but most of the time it's going to be coming from the physician.
We have a good question here from Will. Can't a patient who isn't even diagnosed with anaphylactic issues request one? Just like in case you have and you don't know. Yeah, a lot of people get allergies. Anytime in life you get allergy, you don't know.
What's up, Will?
What up, Will?
He,
Will,
he follow he follows me on Twitter. Hey,
you look like you're in the
very
desert or something.
is a very good question, and let me tell you something about the rescue space. You don't have to be diagnosed. You can just say, hey, sometimes I have an itchy throat eating certain things. I don't know what that is, right? Doc, should I carry something like that around me? I heard about this film. I guarantee you, the doctor's going to write you script for NFL because think about that right quick.
Liability for them. Hey,
Yeah,
they just told me
yes,
they might have.
because something were to happen to Will
Yeah.
and say, hey, I kind of mentioned that to my doctor. He thought it wasn't a big deal, but it ended up being a big deal, right?
Mhm.
But I think the point that Will brought that up is that in a film, a potential impact the world in a major way. That a healthy patient like you or me that's never had a history of anaphylactic shock or severe allergies could carry it with us to help someone else, to be there for someone who didn't carry it with them or hadn't had a prescription written. I think NFL has a potential to make a huge social impact. So I really appreciate
Just
that
have
question.
it. Yeah, that's a
Yeah,
really good.
yeah,
That's
yeah,
a good way to increase the total addressable market, like you just said.
yeah. It's listen, the potential is massive.
Yeah. Do you
Uh,
know how long the like EpiPen? I know I'm putting you on the spot here, but do you know how long EpiPen is good for? And versus, did they AQST release any data on how long the strip can actually be kept before you have to get a new one? Or
the company hasn't released the official because that comes from the PI prescription,
yeah.
uh, you know, um, information page. So because that has to be approved by the FDA, but the PI only exists after the drug is approved. So before that, the company can't release anything.
What does
But
PI stand for? Are you talking about investigator brochure or?
prescription information,
Okay, okay.
okay?
In
So
our world,
every
it's called
drug,
the investigator brochure. Before it gets approved, it's
okay,
investigator brochure.
yeah. So every drug has a PR, okay, and you find out all that information in there. But yeah, it's NFL will change the world. I know Neffy is approved prior to NFL, and they're gonna do all the legwork for awareness and all that. But the moment NFL is approved, it will be the drug of choice. It's a non-device, only 2%, uh, made out of water. It just it's very durable. It works really fast. I mean, it has so many things going for it, and the FDA is going to have a really hard time turning it down, especially if they keep showing good data. And the last one is the OAS challenge that they have here coming up. So yeah, but in summary, you know, Aquesta is just an amazing company with so much potential. If you and I keep pointing people back to the share price movement of SPRY versus AQST because they actually have similar share structure. So 91 versus 96 million shares with AQST. And so it moved from 290 September 20th, 2023 to 16 something, 1650, September 20th, August 20th, 2024. And so I am actually expecting a similar or even more aggressive price movement as we get closer to NFL PDUFA date.
Yeah, me too. I'm looking at the market cap for SPRY. ARS is 1.1 billion. Shares outstanding 96 compared to 91, I believe, and the public float for ARS is 48.6 million. For AQST, I believe it's like 70 something. Maybe that's the only difference, I think, and we're almost at a zero loss earnings per share now. We're at minus 35 cents a share. So
I mean, think about it. I mean, it's going to have, of course, it's going to have one launch after another, right? So you're talking about early, so Q1 of 2026, and Sherry Krasinski talked about a launch timeline today.
yeah,
And she talked about, and this is why she pointed out something I did not even think about.
SPRY is still losing 47 cents a share with the drug approved.
So, anyways, Sherry said that the prime, time that allergy patients coming in to see their doctors is in March. So she said we're gonna launch in the winter and be ready for when March comes around when we'll just full throttle. I mean, she even thought about that. So this is why hiring Sherry Krasinski was just a huge deal. And to me, it's a game changer. She's a game changer. She's the expert in this space. So,
Yeah,
anyways,
yeah.
if you invested in AQST, congratulations. If you are thinking about it, do some research and add on red days or
Not
whatever you
too
want to do.
late. It's not too late. Look,
No,
compare it to the best comp possible, SPRY,
yeah,
at things like 3 times the
it
market
is.
cap, and not.
Well, it's very rare that you have a situation in biotech that you have something that is so comparable to compare it to.
Right.
Similar share structure, similar drug, right? And you just look at their share price and see for yourself and
Yeah.
compare the two.
Look at the
Right?
market cap. Last question from Will. What is short percentage on AQST versus institutional ownership? This part I'm not very good on, well versed on, so I don't know if you know this, but IOVA, which I don't know what that is, had a massive institutional ownership. That's a great indicator. I think there's been more institutional ownership in AQST lately.
Yeah, it's I don't know the short interest. Funny thing is, I find a solid company. I never hardly ever look at short interest.
I don't either. I don't know if
Because when you accomplish, when a company is doing its thing, the short interest, it will resolve itself. Because if shorts are smart, they better get their ass out of the way, okay? Because they're gonna get buried. All right, and so when you invest in a solid company and you have solid catalysts coming up, and they keeping the promises to you, then it'll take care of itself. IOVA, they have a monopoly in TIL treatment for cancer, in melanoma, and sales for Amtagvi is going to increase over time.
Well,
So,
I just look on Market Watch, and SPRY has like 25% of float shorted, and AQST only 13.
well,
So
those 13, they are what I call brave souls, uh, because
they have to be moving stupid, man. Like they're not looking at. You know how many people I know? Like my brother-in-law does this. He actually makes good money trading, but he doesn't know shit. And I ask him, I'm like, hey, what do you actually know about this company you're trading? Nothing. I'm just looking at the bars and I'm out. I don't want to stay longer than a day. I'm out. And they don't even
yeah.
know what they're trading, man.
Listen,
They don't
I don't.
You think they care about investor day?
Yeah, man. Yeah, I am an investor. I'm not a day trader. I want to find good companies to invest in, because I want to sleep good at night. I want to have a life. And I'm very happy with AUR and AQST and IOVA, VKTX,
What is IOVA?
or IOVA.
That's another one of yours, or
Yeah, yeah, Iovance. They make till treatment. It's very technical, but
wow.
it's wonderful. It saves lives, It's
I mean, at the end of the
unbelievable.
day, that's why we're doing. You work in the space, I work in the space. Like, we understand. Okay, short trader, let them do their thing. I've interviewed biotech CEOs before, and they're like, "Yeah, we got to deal with the shorts and
Yeah,
all this." But if you know the fundamentals, man, you have an advantage over bars and
yeah,
lines. And pretty soon, the AI is gonna be able to day trade better than any of y'all.
right,
You're not gonna be able to invest better than biotech scanner.
right,
He knows investor day. He knows everything coming up.
right.
So, all right. Well, agreed. Been doing this for 10 years now. Day trading sucks. Investing is the way. I agree to you. I'm
Yeah.
no offense to anyone who
But
does.
anyways, really good spending time with you, Dan.
Yes.
Today is actually my wife's birthday.
Ah, that's
So
right.
I have steaks ready to
Okay.
grill. My sister-in-law is coming over. Actually, she's coming over right now. But thank you for this time again, Dan.
Yes.
Appreciate you. And for those who joined the stream, thank you. And if you have any question, ask me on Twitter or ask Dan as well.
The Dragons came through strong on this one. And thank you so much, Biotech Scanner. And I'll look into AUR more because AQST, autopilot, man. Red day, I buy more. That's it. Now I have more mental capacity to invest into a new one. So
Yeah.
AUR will be the one I'm looking into. So I see the activity behind you, man. Thank you so much. I really appreciate it. Bye bye.
Sure. All right.